ओम धम धन्वंतरे नमः। रागादिरोगान् सततानुशक्तान् अशेषकायान् प्रसतानुशेषान् औत्सुक्यमोहान् हृदान् जखान योपूरवैद्याय नमोस्तु तस्मै। Let me share. This topic is guttate psoriasis. Psoriasis is of several types: plaque psoriasis, guttate psoriasis, pustular psoriasis are some important types. In guttate psoriasis, there will be erythematous region and with some pustules. So psoriasis is difficult to treat. There will be inflammation of the skin and chronic inflammation, and sometimes it is not well responding to the treatment. So in Ayurveda, we give Vamana or Virechana and Shamana Aushadhis. Shamana Aushadhis like Gurtikta Kritam, Gurtikta Kashaya, and Patola Katalohinyadi Kashaya, Mahamanjishtadi Kashaya, and Mahatirthagam Kashayam, Aragyavardhini Vati, Asamanikya, Kadirarishta, and Gugultikta Grita. So these are some of medicines which are used in the management of psoriasis. This is a patient having guttate psoriasis. Psoriasis is a chronic inflammatory disorder that presents as well-defined scaly erythematous plaques and occasionally sterile pustules. Guttate psoriasis is a distinct variant of psoriasis that is classically triggered by streptococcal infection, this pharyngitis or perinasal, and is more common in children and adolescents than adults. Patients present with several small drop-like lesions that respond well to topical and phototherapy. Psoriasis is a chronic inflammatory disorder that patients has well-defined scaly erythematous plaques, occasionally steroid pustules. Several clinical variants of psoriasis exist, including plaque psoriasis, guttate psoriasis, and pustular variants. Psoriasis frequently involves the joints, leading to psoriatic arthritis, the inflammation of the joints. Nail involvement is found in 10 to 80%. 80% of patients with the psoriasis. Psoriasis displays a spectrum of clinical manifestations and several variants may present at one time in the same patient. Guttate psoriasis is a distinct variant of psoriasis that is classically triggered by streptococcal infection, pharyngitis or perinasal, and is more common in children and adolescents than adults. Patients present with several small drop-like lesions that respond well to topical and phototherapies. This is etiology. Risk factors for developing guttate psoriasis include recent streptococcal infection, oropharynx or perinasal, or upper respiratory infection. Infections typically occur 1 to 3 weeks before the onset of guttate psoriasis. Guttate psoriasis lesions have also been described following TNF alpha therapy. This is a histopathology study. Psoriasis is the model of the psoriasiform form reaction pattern, defined as epidermal hyperplasia with elongation of the ridges. In addition to hyperplasia of the epidermis, there is an elongation of the dermal papillae, dilated superficial blood vessels, hypergranulosis, and perikeratosis. Remnants of neutrophils in the stratum corneum are referred as microabscesses of Munro. A discrete collection of neutrophils, spongiform pustule of Cogus, can also be found in the upper stratum spinosum. This is the patient having guttate psoriasis. You can see erythematous lesions with the pustule. Again, another patient of guttate psoriasis. You can see erythematous lesions with the eruptions, isn't it? So there will be hyperkeratosis, epidermal hyperplasia, and bleeding spot, and there will be increased blood supply also in the region. The other patient, usually in children and adolescents, this guttate psoriasis is common. You can see erythematous lesions with the eruptions, sometimes pustules. So actually, initially there will be streptococcal infection like perinasal or pharyngitis. After 1, 2, or 3 weeks, there will be skin in the lesions in the skin, and in the skin, erythematous lesions, breaks and pustules also form. Erythematous and pustules are formed. Another patient, child, having the features of guttate psoriasis. You can see here the skin erythematous area is there, and some eruptions are that forms the pustule. So there will be collection of the neutrophils in the epidermis, and the papilla becomes elongated in guttate psoriasis, and there will be hyper circulation also will be there. The other patient of guttate psoriasis can see erythematous lesion, and there will be pustules. This is initial stage of or chronic stage of guttate psoriasis. Say skin lesions, chronic inflammatory conditions of the skin. There will be epidermal hyperplasia, and there will be pustule. There will be elongation of the retina and the papillae. You see in the microscope. So this is another patient with the psoriasis. You see guttate psoriasis in the child. The areas, erythematous areas, where the pustules form. The other patient of guttate psoriasis can see erythematous lesions, and there will be scales, there will be pustule-like structures there. The other patient of guttate psoriasis can see the lesion. There will be pustules, eruptions will be there, erythematous background. This is another patient of guttate psoriasis. This is a chronic condition. Chronic. This has become chronic. You can see the color alteration. The color has blackened, and there is a scales. Scales are there. Eruptions also there. The other patient of guttate psoriasis, the leg, you can see the lesions, the toe, and the leg. Inflammatory conditions for skin, chronic inflammation. Another patient is having psoriasis. You can see the lesion just has started. The other patient of guttate psoriasis, you can see the eruptions have they change, become chronic and blackened. So beneath the skin there may be accumulation of leukocytes forming pus. So it is pustules. The initial stage of Guttate psoriasis. You can see the lesion, skin lesion. This is a child showing Guttate psoriasis. You can see the eruptions, the erythematous area and the eruptions. This is another patient, the features of Guttate psoriasis. The disease has become chronic. The leg, the toe is the base of the toe, right toe. There is some there is skin lesion, initial skin lesion, inflammatory condition, psoriasis. The hand, base of the finger, you can see the lesion, skin lesion, chronic skin lesion, that is psoriasis. So under microscope, you can see the skin. So it is a disorder. It is a disorder. The psoriasis is a chronic inflammatory condition of the skin where there will be hyperproliferation of the epidermis and elongation of the papillae and rete. And it is usually erythematous plaques. Sometimes pustules can be seen. So there are mainly three presentations is there: plaque psoriasis, Guttate psoriasis, and pustular psoriasis. In psoriasis, Ayurveda has a better role in the management of psoriasis. We give Virechana, Vamana, and Chamanaushadis. Chamanaushadis include Ugurtikta Ugurtiktaga Kashaya, Patola Kataroinari Kashaya, Kajirarista, Mahamanjistadi Kashaya, Mahatiktaka Kashaya, and Panjaiktagata Uguru. Also, we give Sharivarga Sava, Chandana Sava. Also, the results of these are Aragyavardhinivati, Rasamanikya, and Pushtagaja Kesar, and Lavsuta Shekaravati. So, Patyas like Pittahara, Ahara Vihara has to be followed. Takaraka Ahara Vihara. So, thank you. So, thank you for patient hearing.